Alright, today's going to be our head-to-toe assessment. So first we're going to scan the area. Make sure there's nothing that can hurt the patient. There she is, you just saw her. Okay, so to start we're going to go with orientation. So, hello, my name's Riley. I'm here to take care of you today. What's your name?
Chloe.
Chloe, can you please lay down on the bed for me?
Sure.
Thank you. And Chloe, as you're doing that, can you please tell me your date of birth?
January 15th, 2000.
Alright, and can you tell me where we are today?
We're in the hospital.
In the hospital? Okay, good. So right there, her level of consciousness is good. She knew where she was. She listened to my commands. Chloe, do you have any swallowing, speaking issues?
No.
Okay, that's good. So then we also want to do her hearing. She listens to me fine, responds, so that's good for motor. She listens to directions, that's also good. Next, I'm going to check your pupils. Okay, so can you please just look straight at me? Okay, her pupils are nice and responsive. They're about a 3. That's in a good sort. And do you have any sense of numbing, tingling feeling?
No.
No? Can you please squeeze my fingers? Alright. And then can you step on the gas for me? Alright, thank you. So right there, did you feel that when I was doing that? Okay, so she has no numbing in her feet. That's good. She doesn't have that. Mostly means that she's got it all good for the neurological state. Next, we're going to work our way into cardiovascular. So now I'm going to take your apical heart rate and rhythm. And we're going to do this for 1 minute. Okay, your apical heart rate was about a 63, 64, which is in a normal range. Her beating was normal. There was no heart murmurs, clicks, because you make sure you want to look for that kind of stuff, but her S1, S2 was good. Next, we're going to go right into your pulses. And we always, whenever we're documenting this, we want to do it on a scale to make sure to show how strong it is. So first, we're going to start with the temporal. From there, we're going to go into the carotid. From there, into the brachial. So I'm going to slide up your arm real quick. And all these so far are strong, like you can feel them. They're nice. Next, we're going to the radial. And I won't demonstrate it here, but then from there we'll go into the femoral, which is down here. Next we'll go into the popliteal, which is right on the inside of the back of the knee. Then we'll go into the posterior tibialis. And then finally the dorsalis pedis. And then as I'm down here, we'll check for edema. So we'll feel around just to make sure that there's no ongoing sacs of fluid that are going up from the skin. Also, we'll want to check her capillary refill. So I'll see her finger We'll press in on her nail just to make sure, and it comes back almost right away. That's nice. 2 to 3 seconds is a normal limit. From there, we're gonna do your respiratory. So if you mind standing up for me. And as she's doing this, I want to make sure I look for her depth of breathing. Make sure it's not labored, or make sure it's not labored. Make sure she's not hunched over trying to get air in. From this, she has equal breathing on both sides. I'm gonna now take and oscillate her lung sounds. Just take normal breaths for me. Again. 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 Two more. And one last one. Right, her lung sounds are nice. Do you have any, like, or do you feel like shortness of breath, wheezing, any of that kind of stuff?
No.
We want to make sure, do you, like, have any of a cough or anything?
No.
If she had a cough, we want to make sure it was either productive or unproductive. Excuse me. If things were coming out, we'd call that productive. If that was the case, we want to describe the sputum that was coming out and document it. And then also, if she was on any oxygen, we want to make sure we document that as well. Next, we'll go into the gastrointestinal. So if you mind laying back down for me and then lifting up your shirt to reveal your stomach. First of all, when she does this, we'll want to look around. Is there any masses, anything that comes up? And then any we want to observe any distension that is within. Then we'll want to start palpating around. I'm going to do this in all 4 quadrants. I want to palpate for any tenderness. And then I also want to see if she has a firm or soft abdomen. Right? She got it pretty soft and there's no like tenderness or anything. Next, I'm going to oscillate for her bowels. Okay, her bowels seem to be doing fine. Can I ask you when your last bowel movement was?
This morning, I think.
Okay, that's good. Did you have any like nausea, vomiting, any of that sorts?
No.
And do you like feel when you need to go to the bathroom or anything like that?
Yeah.
Okay, that's good. We wanna. Are you on any sort of diet or anything?
No.
And then also, as we look, like when we first reveal the stomach, we want to make sure we look for any like ostomies. If there's an ostomy presence, they will most likely have a bag over it whenever we see it. So then if there's one there, we may make sure we document that. Next, we'll move into the urinary. Do you have any trouble peeing or anything like that? Any pain?
No.
That's dysuria. Also, do you feel like you need to go to the bathroom? Like, do you know when you need to go? It doesn't just come out like sporadically.
Nope, I know.
That's good. So she has no incontinence. And if she had any like drainage devices, we want to make sure that we document that as well. Next, we're going to move into the musculoskeletal. So if you mind sitting on the side of the bed for me, please. First, we want to assess her gait. Obviously, when she was standing up, we got to assess that. She can stand up straight. It's nice. And then to start with the range of motion, I'm going to ask you to just do the things that I do. So please bend your head up and down, and then to the sides. We're going to check her cervical. Please bend over with your back. That will help her lumbar and thoracic vertebrae. And then if you mind standing up for me. We're going to do the shoulders, so move your shoulders up and down. There we go. Lift your elbows up. We're going to check your elbows. Wrists, up and down. Crunch your fingers. Bend over, touch your toes for your hips. Alright, we're going to stick our knee up in the air. Check your knees. Okay, good. Do the other one. And then lift and do your